How many have thought about being a medical doctor? Hands up. Okay. How many have thought about being a pharmacist? How many have thought about being a physiotherapist? Okay. And how many have thought about being a nutritionist? Okay. Yeah. So the medical field is quite vast. I won't talk more just about medicine because then I will only talk to those few hands that were there. But the whole essence is there will always be someone who's sick. Isn't it? All of you will fall sick at some point, and you will need someone to look after you, someone who knows how to look after you. So the medical field is a very lucrative field and very fulfilling. And the good news I have is almost all of you can actually manage to find yourself somewhere in the medical field. The doctor can't do everything, he needs the nurse. Okay? And besides the doctor and the nurse, there is need for a pharmacist. Besides the pharmacist, there is someone who's needed in the lab to look at the samples that we will draw to get to find out what bacteria you have, okay, or what's wrong with your blood. So someone needs to be the laboratory scientist to check all those things that can go wrong. We also need someone, if your hand is broken, someone who can help you recover, who's the physiotherapist, okay? And sometimes you don't know what to eat or how that food is going to affect you. You need someone who can run you through your nutritional needs and all those things. So there's room for everyone, okay? And the beauty is all of you in this room are capable of joining at whichever point, okay? So my goal today is to open up your minds. If you've never thought about medical field, you should think about it, because so long as they are human beings, they will fall sick, which means you will be forever have a job. It might not always be a formal job, but life is all about sorting out people's needs. So long as you can sort out someone's needs, you will always be able to make it in the society. So those who want to be doctors or any of these, all that is required is for you to have a bit of love for your sciences. How many of us love our sciences? Biology, chemistry, physics, mathematics. Hi. Yeah. Okay. And unfortunately, English, you can't run away from it. Okay. Because you might be very good in all this, but if you can't express yourself in English, it will be difficult. Because all these are delivered in English. Okay, so you have to pay attention to those. The beauty, I will tell you, is that it is not a must that you should be an A+ student in these things. How many thought of you have to be an A+ student? It's not a prerequisite. Not everyone needs to be the A+ student to become a good doctor. Okay? You've heard the first speaker said you have to want. If you want it good enough, that's the good qualification. 2, you have to be consistent. Why I say you don't need to be an A+ student, the human body has been the same for several years. If we start telling you the head is found on the neck, and we keep telling you for 3 years, will you get it wrong with the level of IQ you already have? You will. So it's the same thing. It might just take time, and all you will need is the second aspect to give you consistency. If you are consistent, then it will work. You are patient, focused, you want it well enough, and you are consistent. Okay? The only difference is the one who's the A+ student will get it easy. You get the difference? You will all reach the same destination. If you're not on the A+ side, it might take a year or two longer. But you will still get there if you want it that much. Okay? So that is what we need to drill into you, that some of these conceptions that are taught at some point are not always what will happen. Life is supposed to be made easier, so if you can get better at those subjects, now it is better. But life is round and it's not always the same. Some of you are good in these sciences now when you're in secondary school. It might not be the same when you are in college. These things change. Okay? If I tell you here that one of my colleagues who's doing media there, if you ask these two were with at school, ask them who was likely to be the one doing that when we were in secondary school, he will tell you that it was probably supposed to be me there, because I was the noisy one, and the one who wanted to talk to everyone and do all those things. Was telling you, hey, energy, yeah? You heard that? Wave your hand. He never used to do that when we were in school together. Okay? But life has changed. He is now no longer shy to do that. I am on the other opposite side, I will be reserved. So that's how life is. And what I will tell you, that the medical field is open. One thing you have to get for sure is not all of us can be doctors. Not all of us can be pharmacists. Not all of us can be microbiologists. Not all of us can be nurses. Not all of us can be physiotherapists. But all these have one thing in common. It's all medical. They serve the same patients.